Yeah. Hey, everybody, we have managed to round everyone up. It's been very busy traffic from what I've been told. And we were able to get one of our judges, Solmaz, over from Canada as well. So we're all here. Let us begin. Good evening. My name is Anjum Malik. I am the Executive Director of the U.S. Pakistan Intercultural Coalition, or UPIC for short, a practical peace building program under Seton Hall University's United Nations Center for Global Governance Studies. It is my great pleasure to welcome you all to tonight's event on the Student Innovation Hackathon, which is the culmination of a bigger project on global women's health innovation through cross-cultural service learning. This is connected to the spring semester course, Religion, Race, and International Relations, taught by Father Brian Muthas, and sponsored by Idea Hall, Putting Ideas into Action, the School of Diplomacy and International Relations, and University Core. The Idea Hall project is a multi-sectoral collaboration that brings together 4 Seton Hall campus divisions and 3 external industry partners. We are so grateful for our partnerships with the University Core, the Teaching, Learning, and Technology Center, or TLTC, Campus Ministry, and the Division of Volunteer Efforts, or DOVE. We are proud to collaborate with Pink Detect Incorporated, Just Results LLC, and the Rose Castle Foundation. The Idea Hall project is the result of the combined efforts and support of prominent members of Seton Hall's leadership and student body. I would like to acknowledge Dean Courtney Smith of the School of Diplomacy, Professor Nancy Enright, Director of the University Core, and Giselle Pineda, Assistant Director of the University Core, who is with us here today. Hi, Giselle, all the way in the back. Thank you for helping to make this project possible. Our organizing committee includes 3 master's students in the School of Diplomacy who are also members of UPIC's inaugural cohort of student representatives, Joella Zwack, Safwan Ali, and Caitlin Wilson. We are fortunate to also have the support of diplomacy graduate student Zuleha Chitti, who is in charge of the event flyer and the promotion. Zuleha, thank you. Thank you for bringing such enthusiasm and dedication to this project. We are especially honored to have with us distinguished guests, including UPIC's co-founder, Reverend Robert Chase, Pink Detect's co-founder, Suha Lalani, Just Results Research Practice Manager, Ali Miller. Oh, Ali's right there. Hi, Ali. And the Union Congregational Church in Montclair's esteemed member, Roxanne Kent. Hi, Roxanne. We are thrilled to welcome back our guest speakers for the Idea Hall skill building workshops, Kate Sierra, Solmaz Ibrahimi Iranpour, and Lara Goldmark, who will be serving as hackathon judges tonight. Matthew Wan, our guest speaker for the scriptural reasoning workshop, unfortunately had to drop out of tonight's event due to a sudden family bereavement. Reverend Bob Chase has kindly agreed to step in for Matthew and be part of the hackathon judging panel. I would now like to invite diplomacy graduate student and UPIC student representative Safwan Ali to introduce tonight's student hackathon and pitch competition. Safwan, the podium is yours.
Thank you. Thank you, Anjum, for the opening remarks. Good evening, everyone, and welcome to the Student Hackathon on Global Women's Health Innovation. It's wonderful to see you, an engaged audience, as we bring together ideas from the Religion, Race, and International Relations course into a space of innovation and real-world impact. For tonight's event, our students stepped into the role of social entrepreneurs to design practical digital solutions to expand Pink Detect's mission of breast health management and breast cancer awareness in East Africa. These solutions are rooted in real-world challenges, including access to healthcare, cultural perceptions, and communication barriers, and aim to offer solutions that are both innovative and culturally responsive. These digital solutions are also, as artifacts, are built on the course readings and the Idea Hall skill building workshop on Adobe Express tools, social media content creation, scriptural reasoning, and analytical approaches. 9 student teams will present and their ideas before a panel for 4 judges. They comprise of Kate Sierra. She's the senior instructional designer at Seton Hall University's Teaching, Learning, and Technology Center. We have Solmaz Ibrahim Iranpour, co-founder and CEO of Tech. We have Lara Goldmark, founder and CEO of Just Result. And we have Reverend Bob Chase, the co-founder of UPIC. Our judges will evaluate each student's team's solution based on the following criteria: clarity and depth of the problem and the potential opportunity, the strength, feasibility, and innovation of the proposed solution, effective use of Adobe tools and Idea Hall skill building workshops, the feasibility of the implementation plan and its potential impact. Teams that demonstrate strong contextual awareness, creativity, and practical thinking will stand out. Each team will have 7 minutes to present a 5-slide PowerPoint presentation, followed by a 3-minute quick Q&A round from the judging panel. All student teams will be strictly timed to ensure fairness and allow every team an equal opportunity to present. To recognize the outstanding work of our students, prizes will be awarded to the top 3 teams. Each winning team will receive a cash prize funded by Idea Hall, a certificate of achievement designed by the Pink Detect, and a gift bag of Pakistani souvenir from the Cultural Handicrafts and E-commerce Enterprise. Holy and Other Stories is the enterprise, funded by Reverend Bob Chase. In addition to this, the first place winning team will receive the incredible opportunity to do an accelerated summer externship with Pink Detect, where they will receive one-on-one mentorship to develop their digital solution for on-ground deployment. This concludes the hackathon rules and guidelines. Judges, please have the online judges rubric ready on your laptops. Students, please be ready to come forward when your names are called. We are excited to hear your ideas, your creativity, and your vision for global health innovation. I now invite my fellow UPIC student representative, Joel Azak, to moderate the pitch presentation and Q&A session. Thank you.
Thank you, Safwan. I'd like to begin by introducing Team 1. The members of this team are Kayla McIntyre, Zachary Cooney, and Janira Mitchner.
Hanira.
Oh, I'm sorry, Hanira. Thank you. Please correct me. T1, please come forward. I will give you a 1-minute warning before your time is up. Team 1, your time begins now.
Hello, everyone. Thank you very much for being here and letting us speak today. So our project and artifact is focused on community outreach. Next slide, please. So the problem that we saw was that in East Africa, breast cancer has a high mortality rate due to late diagnoses and limited access to care. And due to that limited access, there comes a societal and a social stigma around that, which really dissuades women from pursuing their breast health. So our goal is to give women patients and healthcare professionals a space where they can address their health concerns without stigma and learn to take their health journey into their own hands.
Hello. So once again, thank you. Our proposed solution is essentially how do we utilize what we already have? So by coming up with our solution, what we did was we looked at ways of communication that is already available in East Africa. So one of the most popular apps that is used is WhatsApp. So WhatsApp is founded or made part of the Meta apps, which includes Instagram and Facebook, which have over 2 billion users daily. So what we were doing is we thought about, why don't we do pop-up clinics around East Africa similar to the breast screening camps in Pakistan? Well, yes. However, how do we get this information out? So the idea we came up with is to use WhatsApp to create community. we asked ourselves, are we using this app to its fullest ability? So what we did was we utilized almost every single aspect that the app have to offer, including stories, channels, and other different communities. What I'm going to do right now is, if you do have an iPhone, if you can drop your AirDrop on, and I can send you the link to our community. Or you can scan the QR
Yeah.
code.
You can also zoom in here and scan the QR code and take you directly to the WhatsApp community. The thing about this community is that there are separate channels. So like Kayla mentioned, there's a channel for announcements and for information to be spread. But there's also a separate channel for women to talk directly to each other about their experiences and their own health journeys and try and rely on each other.
And also with that, we were wondering, can we utilize live streaming, such as having a doctor or a health professional give advice or answer women's questions live on air? So we realized that there's actually a feature on here where you can actually have multiple people in a call. So that can also be utilized as a space, and we can give reminders for when these calls happen that we like to call pink alerts. Can you go next slide, please?
Our Adobe, we actually use Adobe tools a lot during this process. A lot of our flyers and the information that we spread were used using Adobe tools, as well as a lot of the QR codes that we made up. The idea was to make everything as easily accessible as possible. So we did utilize a lot of QR codes to link patients to the Pink Detect app, to the community WhatsApp, to a page of resources for them to look at. Next slide.
So incorporating the 3 previous idea halls into this artifact, the first one was social media content creation, and that is through the Adobe Express, which it really allows the user an incredible vehicle to create content that is engaging, is in depth, and can attract the attention of a curious person. So many tools within Adobe Express that allow us to create insightful and creative information and to blast it out on all social media platforms. And then with scriptural reasoning, we wanted to incorporate the skeletal structure of scriptural reasoning, where you create a judgment-free, safe, neutral environment that is not comprised of people trying to hardline persuade someone or convince someone to go down a certain path. It allows the person that is coming forth to discuss their health issues. So as we saw in East Africa, that the societal stigmas of breast cancer health are very, very bad. Like they, do not perceive women to go about their health. So having a structure and a space where women can come to talk about their health could help decrease the mortality rate. And then the third idea hall, which was analytical approaches, we were able to think of concise ways in which we can put our message out there to the masses, something that is, concise and practical for all users. Next slide.
Okay, so implementation plan and impact projection. So as we roll out this campaign, the main purpose is to connect. What we wanted to do was to utilize an app that is already used in these spaces. Yes, we have to understand that within East Africa, it is a very large space, and we also want to be mindful of the fact that there are things like power outages or spotty internet connectivity. So we want to use something that is already in use, but we also want to make it concise and create a community that is already there for them. So we wanted to provide patients who attend screenings with resources, access to community WhatsApp via QR codes and have engaged outcomes, reminding
Your
people.
Presentation time is concluded. Judges, you have 3 minutes for deliberation and questions starting now.
Where are you gonna do the clinics?
The clinics can be a pop-up around different areas, so focusing on more populated spaces and then focusing as money comes in or as time goes on in more rural areas that is harder to access.
So, in terms of, the feasibility of this, one of the problems that we have, or one of the problems that we were facing just in general about expanding into East Africa was, having somebody, an ambassador, somebody who's, trustworthy within the region. So how would you, I guess, kind of break into that region to begin with in terms of organizing these pop-ups?
I think our huge thing was confidentiality to make women feel safe. And so going into East Africa, we have to be able to provide them with a sense of privacy. With this feeling that they won't be judged and that their information won't get out. If on one of the slides, I actually have a flyer for these pop-up clinics. It's not too informational. It's kind of vague, but it also gives them the knowledge that this is what this clinic is for, but we don't want, others to be in your business, basically. So we're keeping this as confidential and as low-key as possible so that you feel safe coming into us.
That actually leads to my question as well. Because of the confidentiality, how can you reassure women that they'll be safe? That yes, they have the privacy, but at the same time, if they're asking for help, how do they know that they're talking to who the person says that they are on the other side of the WhatsApp app?
Okay, so with that, the thing is that with WhatsApp, it is a private community. So only people that are approved are really allowed in. So that can also include going to these events and getting the QR code to link in. And then also with doctors or anyone that we are collaborating with that may be in the WhatsApp, they do have to be approved and they do have to state on their names who they are within these groups and communities.
Okay, thank you.
Just quick, do you have a strategy for communicating successes in terms of once you've gotten underway so that others can learn about the work you're doing?
Yeah, so one of the features in our app, I forget what channel it is, but we, after these events, these live streams with doctors, we want to hold like this, a Q&A afterwards, sharing what we learned, and sharing ways in which we can spread the message of Pink Detect and,
Your time is concluded. Thank you.
All right, thank you.
Team 2, please step forward. The members of Team 2 are Francis Hernandez, Zuleyha Sait, and Emily Harass.
Very well.
Yeah, we'll just leave it in, yeah.
Celebrate theater. Team 2, your time begins now.
Okay, hello, everyone. Good evening. My name is Francis Hernandez. This is Emily Harris and Zuleyha Sait. And for our presentation, we focus our digital solution on we didn't want to reinvent the wheel, but showcase the app feature that would improve engagement with partners, patients, and donors, and specifically showcasing the impact and the credentials of Pink Detect and the work and the impact they've had thus far. And the second slide.
Actually, the previous, exactly.
Yeah.
Thank you.
We actually used the diagram that was used in the Just Results workshop. We started off with our activity being showcasing organizational credibility. Like I said, we really want to reinvent the wheel, so we wanted just to focus and showcase the Pink Detect credentials in order to begin our relationship in East Africa. The output would be promoting app and to partners and or donors, getting them familiarized with our app, with the app, and the features that it includes, and also door knocking. I'm not sure if anyone's familiar with this, but in real estate they do door knocking, so going door to door, engaging with the local community and the women's health clinics, if any, in the region, to gain that that trust and that networking, and even that kind of like them vouching for us. Outcomes would be increasing funding. Well, this will lead to increased funding and partnerships within the region with reputable clinics, which will also produce, personal testimonies and or client reviews that we can kind of help us take that leap towards the expansion. And then, but also keeping in mind cultural and religious sensitivities of the region. Like we've taken the second workshop of scriptural reasoning and just understanding the cultural, the religious, and the societal norms within the region, that we want to make sure that it's always at the forefront of our interactions with our partnerships. And then ultimately it would lead to the impact of expansion into East Africa. But before we begin, just a few demographics. Next slide, please. And so we put together this presentation with the religious groups within the region. This would be the what would make up the region of East Africa that I guess we would be focusing on. Just also important to take note of the linguistic differences, languages, and it's a tribal region, so just keeping that in mind as well. A few stats that we wanted to also just use to emphasize the significance of pick-to-text resources within this community would be that although there are lower incident rates of age standardized within East Africa compared to West Africa, there is a higher mortality rate in East Africa. As well as the United Nations Population Fund has estimated that only half of the primary health facilities in the region are fully ready to provide essential primary care. So pick detect is definitely needed. It's vital in this region.
Thank you, Frances. So we do think that the organization's credibility absolutely goes from the social media, the digital presence, and we wanted to go to the archive, and we realized that actually there are many important social media recognitions, the social media outlets, the mainstream media that are already highlighting the work of the Pink Detect. And next slide, please. And we wanted to follow the strategy on social media by sharing the social media recognition to promote more, the social media collaborations with donors, with other international organizations, media outlets, or even within the corporate life. So the first article, we realized that when tech meets purpose, we are already in academy. The Pink Data already exemplifies the sophisticated integration on technology within the health investments and everything related to the academic aspect of this. And also we have another social media outlets by the USA Today, where our founder, the Sulaimani already shared an interview with the USA Today, and we have more there already. So we think that starting a trend, and highlighting the already existing collaboration within the social media will actually promote the work that we targeted in the East Africa and even more together with that. And I do think that as a result, there are other international organizations, especially we know the African Union and other African members in the United Nations and other organizations extremely active. And in the end, we were thinking, why not maybe, the collaboration within the digital communication department within the UN or other organizations within the targeted region would actually promote the work even more.
Yeah,
Next slide, please.
just like Zuleyha said, I think it's
1 minute
important.
left.
I think it's important for us to keep in mind that we don't have to, like I said, reinvent the wheel. The work has been done. It's just showcasing it and emphasizing it in order so we can branch off and attract more
partnerships.
Exactly. And the next slide, please. Yes.
So promoting the app partners and or donors, what does it do? This expands donor portfolio, increases application usage, and a one-stop shop for both practitioners and potential clients. Like I mentioned before, we went over it, but just what it looks like: door knocking, creating relationships with locals, familiarizing with regional communities, values, culture, and societal norms, and cultivating partnerships with potential partners. So specialists, doctors, physician assistants, etc.
And lastly, we have the outcomes. And
Thank you. Your time has concluded. Judges, you have 3 minutes for question and answer starting now.
Did we end off in the one before this though? Sorry.
I guess I just had a question. So how would you actually like do the door knocking technique that you mentioned?
I think if we have staff members that we can start as ambassadors to do, I think it's very important to make potential clients and partnerships feel comfortable and bring a familiar face. So I don't think just having someone who doesn't really know about the structure and the culture of the organization would be someone that we would want to place in such a, I guess, monumental shift in this expansion. So definitely someone that's familiar with that we think is educated, understands the culture, understands the importance of the impact to represent us in the store knocking.
yeah, just a follow up to my colleague's response. As we highlighted, local women's health clinics will be our main partners. So I think institutionalizing these door knocking through the actual representatives already exist in the clinics would be, more creatable strategy. So that's the only thing that I wanted to highlight. I think going through from a collaboration that official and legitimate would make the promotion even more creatable.
And just to go back to what you said, I think eventually at some point, the training can be provided to have people step in and take that role. But just to begin with, just because we want to extend that olive branch, it'd be vital to have someone that is, like I said, like we said, familiar with the culture, familiar with the mission statement and what Pink Detect has in mind for East Africa. Yes, ma'am.
2 quick questions. Is the app free?
Yes, the app is free.
And then am I right that your solution was the media stuff? Did I miss something?
Well, so by expanding, we think that it's better to start, I don't want to say a funding pool, but like partnerships with people, with practitioners and clinics in the region. But that will start by showing the credibility of Pink Detect,
So basically, the enhancing the credibility of the organization. And we just wanted to start with the East Africa specifically because of the numbers and the already existent efficiency that we realized over the region.
Any other questions? Great.
Thank you so much.
Team 3, please step forward. Members of Team 3 are Luke Bays, Raymond Clairhue, and Yanni Dades. Team 3, your time begins now. Yeah.
Good evening. We're here to talk about empowering women through communication. My name is Raymond Clairhue.
I'm Luke. I'm Yanni.
Yeah. So the problem we seek to resolve is the lack of community and communication. Pink Detect's platform allows people to browse FAQs, find medical professionals, and monitor their breast health, which are all super important. But breast cancer takes a toll that is not limited to just the physical. It also includes the mental toll. And so we want to make sure that people can find a community and create community. By creating a digital forum and conversation space, Pink Detect can help create those vital connections, as well as tearing down stigma and create a cross-cultural community that is aimed at answering questions and sharing experiences. And those involved would be patients, medical professionals, and healthcare partners.
So we are on a tight time limit. So in order to get through our design philosophy, we have created this acronym called CHATS to explain how a in-app chat forum would help allow women to communicate their problems across the continent. Starting off with C, we have complementary. This means that it's available, it's open. People can come across from all walks of life to talk about their issues pertaining to breast health and breast awareness. It is human, meaning that this is a platform that is supposed to be free to all. It's supposed to be without bounds, and it is available only to those who truly have a desire to actually help sustain the prevention of this issue. It is anonymous, which means people should feel free to express what they want out of it, meaning that their identity will be completely anonymous. Therefore, they don't have to worry about cultural or social pressures. They could just share what they need to share in peace. It is thoughtful because it is meticulous. We're not talking about how yesterday's soccer game went. We're talking about how we are here to help breast awareness and healthcare in Africa, and we're here to talk about its possible solutions. And finally, S, it's secure. This is moderated. We're not trying to have people who are here by their own malicious endeavors to try and propagate some sort of narrative. It is here simply to help those so that the people who are actually utilizing the platform can do it safely.
So part of the judging criteria was how we use the Adobe tools in the actual creation of the artifact. And so we have our main two, I guess, distinctions between this, which would be number one, of course. We used both we used the Adobe tools to create both the slideshow and the artifact itself. And the main two, of course, were Adobe Express. So they were brought to life by using the Express with its features, which allowed us to create shapes, create graphics in order to put on the thing itself, and also word it in an anonymous way to make sure that women aren't threatened by the idea of cultural stereotypes. And of course, Photoshop as well. Photoshop helped us edit the pictures in order to color match so it didn't look like you're staring at color vomit. And it ultimately helped endure the final product.
So our use of Idea Hall lies in 3 different areas. So Pink Detect allowed us to fully understand the stigma and isolation that women face, as well as the importance and value of digital marketing, especially through social media, which we'll come to in a moment, as well as the scriptural reasoning brought attention to the importance of creating dialogues and the value of different perspectives and cultures. And then our just results impact, that was mainly through the theory of change. So our idea is we have our ultimate goal and we have what we already can use. How can we meet that in the middle? So we use the theory of change framework. That also helped us come up with our implementation plan, which is on the next slide, I believe. Implementation. So it starts with the creation of a forum. That would be through the Pink Detect app, starting with example posts based on the FAQs, based on medical professionals and those in the field. And then also, starting with starting with women's stories. So that gives people, a baseline of how to approach participating in the forum, staffing the forum with medical professionals for support who can help answer questions, who can lead discussion, be involved in that, and then also moderate it so that it is appropriate, so that women don't feel threatened being involved in the discussions. And then using social media to generate excitement. That's a huge tool that Pink Detect is already employing, making sure that people are excited and know about this new feature coming up so it doesn't dissolve into the background of the app. And then rolling out the public forum, and that's going to be, getting people who are already involved in using the app to get involved, but also, when you go and you're doing workshops in the region, making sure that it's part of the workshop structure is highlighting its value. And then also encouraging longtime users to share it to make sure that people get that push to get going, because you don't want it to just be an empty forum. You want there to be something that people can already interact with, so it doesn't feel like they're just sending it out to everyone in the world at once. Yeah, that's our presentation.
Thank you, Team 3. Judges, you have 3 minutes for question and answers starting now.
Yeah, so I have a question about, you were talking about both the physical and then the mental aspects of breast cancer and the impact that that has on individuals and communities. Did you do any research or consideration of the spiritual aspect of what that means, of what, you know, breast cancer has on individuals, their spiritual side?
So religion can really play a lot in determining how people present really their medical history. In fact, in a lot of nations, it is in particularly the ones that are fundamental about their beliefs. It can really be hard for women to kind of go out there and kind of talk about their breast health because it could be seen as unpure in some cases. We want this to be kind of centered away for women to kind of separate their religious beliefs in order to talk about more their issues pertaining to themselves as a social issue. That's why it's meant to be anonymous, because if women choose to talk about how their religious and spiritual vows play into it, they can of course talk about it. But if they don't want to, if they think it's a little bit more personal, because religion is both a cultural and personal relationship, they're free to do that as well.
Yeah, I think the anonymity is center too.
I have a question, even though I'm not a judge. So we actually thought about integrating this chat feature 8 months ago, but we dropped the idea because there's a lot of AI tools now where you can have conversation. They're secure, they're anonymous, like ChatGPT, Claude, and then there's other health apps within Tanzania and some parts of Kenya as well, where you can actually talk about your reproductive health, not just breast health. How are we going to have a unique value proposition so that users use our chat feature and not turn up to ChatGPT or Claude?
I ask a question about that? So you said there's these apps in Tanzania and Kenya. Is it AI talks or is it talking with professionals or talking with other?
There's actually both. There's one, it's called Maya Baji, that basically has human-centered reps that actually come and take over the chats and talk to humans. And then there's also AI-powered chatbots that take over the conversation, where AI is trained to answer some medically sound inquiries or answer questions that women might have. So what unique value proposition are we going to have through our chats feature?
I think that part of it is that things remain in perpetuity, so people can go back and refer to things. Another thing that's unique about it is it's not just limited to people in Africa. The idea is to connect you really across the entire Pink Detect network. So women in Pakistan can share their experiences, and women in Tanzania who see that can feel connected to that and can respond to that.
The members of Team 4 are Lamont Howard, Aya Gusmolisi, apologies if I butchered that, and Kennedy Mayers.
Oh my goodness.
Don't worry about it. Team 4, your time begins now.
Hi everyone, thank you guys so much for coming. So my name is Aya.
I'm Lamont.
I'm Kennedy. And so our idea for today is going to be a WhatsApp awareness campaign. And then, so with this, obviously, as we've talked about, and there is like a lack of access to resources in terms of in the area of West Africa or East Africa, excuse me. And so kind of to fix that gap in breast health awareness, a lot of obviously like many women in East Africa, like I was saying, they lack access to early screening info, face stigma, and misinformation. And then they also have low literacy or language barriers. And while the internet access is inconsistent, WhatsApp is widely used in that area by several countries. So what exactly is the awareness campaign that we have planned or have in mind? So specifically, it is a weekly WhatsApp messaging. It's visual graphics, kind of just so to kind of limit the language barrier. Obviously, there are several languages in East Africa, the main three being English, Swahili, and Arabic, from what we found. But to kind of limit that gap or the language barrier, like I was saying, we would send out these visual graphics, and then we would have 30-second voice notes translated into the three languages, and we would have different groups or organizations. And I know one of the other groups was talking about the community feature that they have on WhatsApp. We would make different groups within that community for each language. So for English, one for Arabic, and one for Swahili, and then we would have translators, obviously, to confirm everything. And then the way that it works and why WhatsApp is so popular in that area, obviously, like I said, with internet access, it can be a little bit spotty, but it doesn't require much data usage. And then the voice to text is also very accessible. And it's very obviously it's trusted voices and whatnot. And then it's also delivered by local female community health workers. So it's trusted information.
So how we use Adobe Express. Honestly, we obviously use it for our presentation, but also within like the app too. Sample messages, hello, and like a tip. So we would like create these visuals using Adobe Express. And also with the voice memos, since there is language barriers, having it translated into the languages will feel so much more personable. Same like I like to put myself in their shoes, and obviously I would feel more comfortable if I could, communicate easily, and if someone who doesn't speak English is talking to someone who does speak English, it might just be a little awkward for them. They might not feel as comfortable. So that's why we would do that. And also Adobe Express allows Pink to Tech to create cultural relevant and low bandwidth content at a scale.
Using ideal hall integrations, the first one being the social media aspect, which like amplifies the audience first messaging. And it also has simple and visual storytelling. So the message is not lost and it's not just crazy graphics and simple, it's to the point, but also has like caps their attention. And the second one is the scriptural reasoning. Of course, going into East Africa, there's many different languages, tribes, religions, and stuff like that. You always want to see cultural aware and respect the beliefs there and have a non-judgmental tone. And then also, of course, be community-centered and have that community-centered communication. And then lastly, the analytical approaches kind of talks into the pilot, which is the last slide, which talks about doing it first, like 1 to 2 communities, having feedback from that, and then adapting, and then having a data-driven improvement. So it's not just random improvements, it's what the users want to see. And then going from the pilot to the scale, it will start out in like 1 to 2 communities, weekly messages, collect feedback from like via WhatsApp polls, how many likes people are sharing and stuff like that. And also adapting the tone and the language, but also it's going to expand regionally into other areas. And the impact is it would increase awareness, but also have a higher screen participation. And it's also scalable at a low cost.
So this is kind of just we created the WhatsApp itself. It's just a visual for you guys to kind of understand like what we mean. So with the community feature, there's the announcements tab over here. We send out the Instagram, obviously like little words, just so it's like everyone understands what it is. This is the Instagram. And then going into each of it, this is it in Swahili. And then this is the separate one for Swahili, obviously. And then there's the Arabic one over here. This is just a sample message translated. And then there's the English feature as well. And then there's a general area for people to send questions or anything like that. Even with the general area, we can make a general one for English, one for Arabic, and one for Swahili, obviously, just so people can send questions. So they have a way to like voice their expressions and feelings. Yeah.
Great. Thank you, Team 4. Your presentation time is concluded. Judges, you have 3 minutes for questions and answers starting now.
I have a question about the 3 different languages. Who's translating the message, and how do you ensure that the translation is accurate culturally?
Yeah. So obviously we would get professionals who obviously speak the language. I personally speak Arabic, so in that sense, I know like I could read that for sure. But then obviously we need someone to speak Swahili, someone speaks English, and then later on down the line we could get more languages. And like if there's more niche or communities who speak like languages that not many people speak, we get a professional in that sense as well. So that way everyone kind of feels like they're heard and that like we know the information that we're delivering is correct.
So everything goes out in all 3?
Everything would be the same information, but that way it's more accessible to everyone. So everyone knows what they're talking about and everyone knows the information that they're getting and understands it as well. So it's not just, oh, here's information, figure it out.
I did have a question. Is there like controls on the actual chat room? Just because like me, someone who like I detest group chats because I get spammed all the time.
Yeah.
So is there like controls for okay, when someone has a question, they can ask it, or a limitation, or even like guidelines on, respectful word language? Um, so I was just wondering if there's any controls when because it seems like it's a forum, right? Like kind of like the chat, but like on spaced out of the WhatsApp. But is there a formality to it? Are there controls to it?
Yeah, so like the WhatsApp community. I think one of the other groups was talking about as well. There's a feature where you have to get into the group chat, and then there's obviously like the new, it's like you can mute the group chat, or you can only get notifications for certain things and whatnot. So that way you're not getting spammed. Obviously, no one wants to get spammed. But then also like people who run it, like the admins, there could be a feature where only the admins send messages and nobody else does. You know what I mean? So it
Okay.
just depends on what it is.
What was your sample message about, since I couldn't read it?
Oh, you want me to go? Oh, if it's in the slideshow, I took it out of the slideshow, so it's just easy.
Is it this one that
you
you
Yeah.
had?
Oh, okay.
Yeah. It's just a little tip, like what we were saying, keep it like pretty simple so that people don't get overwhelmed with information.
Since it's on WhatsApp, are there concerns about lack of anonymity since your phone would normally be connected and your personal information?
I've been in several WhatsApp group chats and like you could always just there's like a specific feature for you to like hide your phone number. So you don't have to put your phone number, but you could still get like via the group chat.
There isn't like it wouldn't be like personal medical information on there, right? Okay.
Good. Thank you, Team 4. Team 5, please step forward. Members of Team 5 are Fred Boom, Lana Corson, and Megan Lauren. She's unable to. Okay, perfect. Team 5, your time begins now.
Hi, everyone, and thank you for listening to our project. We are Alana, Megan. Unfortunately, Carissa isn't able to make it. So this is our project. It's called Tumaini Solution, the grassroots solution, and Tumaini means hope in Swahili. Our presentation really focuses on how Pink Detect can expand breast cancer awareness and early detection efforts in rural East Africa by working through the people and the institutions that are already there that the community already trusts. Instead of assuming that formal healthcare is alone will provide enough support to this problem, our approach starts at the grassroots level by building relationships between locals and healthcare workers, improving education and knowledge, and creating practical community outreach programs. To understand our solution, we first have to understand the problem that's actually happening. So the first problem that we found out is the societal barriers. In a lot of rural communities in East Africa, women may distrust formal healthcare systems due to a variety of reasons. Because of that, they turn first to traditional or spiritual healers, which then leads to, unfortunately, delay in breast cancer diagnosis and treatment because they do not have enough resources to detect it fast enough. One statistic that I found is that the use of non-Western medicine is very large in East Africa. Available studies report that more than 52% of patients with cancer have seen traditional healers for alternative treatments. Another issue is the resource gap. So many of these communities have very limited access to hospitals, clinics, or screening centers. That means early detection is not delayed, and in some cases, it becomes nearly impossible. Our target audience reflects this reality. We're not only focusing on women, but also on faith leaders, traditional healers, NGOs, nonprofits, and faith-based organizations. And these groups already have credibility in their communities and can help bridge the trust. So our opportunity is clear. If Pink Detect works in tandem with the local and faith-based leaders, it can bring awareness, improve trust, and make screening outreach much more effective in rural communities. And that leads into our solution.
And now I will be covering the rest of the presentation to protect her voice and all of that. But we kind of broke it down into 3 different aspects. First, with partner. And this starts with building relationships. In this case, Pink to Tech would connect with faith-based leaders, traditional healers, kind of all of the leaders in these different communities that the community already trusts. And by utilizing that trust, we can bring out that medical outreach that Pink to Tech is always preaching and working with. Listed underneath are some examples of key partnerships we think would be invaluable with East Africa. And in this scenario, we wanted to start with one country as an example. So all of these organizations are key pivotal religious organizations with Tanzania. The second one is to educate. Once we have these organizations established with these partnerships, we can now expand health knowledge. And this includes using pre-established screening camps and like the format that Pink Tech already uses in Pakistan, but now we start making those applications by having these faith-based organizations sponsor those camps. And that continues that like inter-trust dialogue. The final phase is to refer. Instead of replacing what already exists, the project builds on the current infrastructure. In this case, communities can be given pamphlets, educational materials, and access points where Pink to Tech is possible. This makes the solution practical for low resource environments because we recognize that not all areas in Africa have the same access to care and same access to technology as other places around the globe. Overall, this isn't just a top-down strategy, it's a community-first model built off of trust, education, and referral. Now, how did we use Adobe Express? We developed an infographic to turn this solution visible. Outside of just creating the slides presentation, we decided to give a brief outline of what the project is. When technology is limited, as we expand local outreach, this is something that we can use to tangibly show as a reference. The design is simple, with limited text, and primarily supported through recognizable symbols, as you see there. It's intended to function as a practical trust instrument. So, in other words, it's not just informative, it's something that we can use to introduce the project in a way that feels approachable and understandable. So it turns a difficult implementation concept into something that is usable and accessible as a communication tool. In addition to the design itself, our project was also shaped by what we learned in the Idea Hall workshops. For social media creation, instead of solely basing it off of social media, one of the key takeaways that we learned was the importance of visual imaging, creating things simply so it's better to understand. That lesson directly shaped how we created our infographic with its layout, its key facts, and its visuals. The second thing was scriptural reasoning, that idea of dialogue, since our solution is solely based off of that trust that is built between respectful dialogue between religions. Third is from analytical approaches, where we learn that to solve a problem, we need to start with the grassroots, with the basis, and which we found was in the spiritual care. So these workshops did not just inspire the project, it directly shaped how we communicated it and developed it to where it is today. Now, on to implementation and impact. We don't want to just build something new. We want to integrate Tumaini into Pink Detect through these different steps. First, by building the partnerships, then launching community outreach programs, as mentioned, with the community program and screening camps that Pink Detect currently uses. And then finally, collecting feedback and improving on the model and expanding to additional communities, because we want to start with Tanzania or any other East African country that we're able to build these FBO partnerships with, and then expand it outwards by taking the information we learned and then applying it. Finally, because we know that you can't just make a solution without tangible numbers in mind, we have trackers, markers that we need to show and to identify to see if the solution is working. And that's through increased awareness of breast cancer, the increased amount of women in those communities engaging with it, and the increased amount of referrals to Pink Detect as we go to these different camps and these different locations and exposing them to the work and the mission that Pink Detect continues to do in Pakistan and as we hope they to continue in East Africa. Thank you, everyone. 5 judges you 3 minutes for question and answer starting now.
So I'm super curious how you're going to get those partners to trust you, especially some of the traditional healers.
So in this scenario, we recognized that there's a lot of like international health branches, and we thought that could be the first step before we start expanding to like other communities. And this already is a working model that works in a lot of different African countries, specifically in Kenya. So there are like Christian churches that will start clinics, and then through these Christian churches, they get the resources and trust from the community, and then kind of like back and forth. And we thought we could use this model with Pink Detect, but instead of it being like a clinical model, we can have Pink Detect camps come into these locations and into these like spiritual places of worship, and having those leaders being the ones to say like, hey, like this is what's going on and this is how we can show that work.
I have a question. What about like agnostic groups or even like the fear of potential clients not wanting to go to a clinic because of the religious affiliation? And, there have been, religious persecutions abroad. And so I wonder if that would be something that a potential client would fear if they went into a specific clinic that not necessarily they identify as that religious group, but that they want the services for.
So again, like our solution isn't based off of you going to the clinic. It's based off of Pink Detect and Pink Detect's people going into your community and being there for you if you would like to have those chances. So it's not necessarily like we're pushing those like opportunities to you. It's just we're giving you the opportunity to have these people there, here to answer your questions and here to support you if you would like to reach out to them. So it's a little bit different to how you.
Yeah, do you have any suggestions about strategies integrating with government officials or local government officials? So that addresses will address the whole fear of religious involvement or something like that. So a more secular approach.
When it comes to like the approaches, like I mentioned in Africa, how countries have been able to like develop it is through like just considering it as its independent entity. And if we look into the future of potentially working with government programs, I think the biggest step is just recognizing that healthcare isn't like it's non-partisan, and we want to make sure that they're being offered the resources, like I mentioned, and they're not being pushed upon them. So it's truly their decision of whether or not they want to take it. Kind of leave that balance.
All right, judges, your time is concluded. Thank you, Team 5. Team 6, please step forward. The members of Team 6 are Amindata Dukure, Ryan McCafferty, and Robert Hughes. Team 6, your time begins now.
Okay. All right. So, hi, I'm Ryan. This is Robbie Aminata. So the problem we identified is that there are many barriers to timely breast health in East Africa, not just breast health generally, but timely breast health. First one is finances. Even though socialized medicine is improving in the region, many women are still paying out of pocket for treatments. This delays treatment or prevents it entirely in some cases. Second is distance to healthcare and low digitalization. There's a physical component in that healthcare is concentrated in population centers, and there's a digital component in that it's estimated that only 24% of the region regularly uses the internet. Third is religious, cultural, and linguistic barriers. The two primary faiths are Christianity and Islam. But within that, there are conservative elements and liberal elements. The conservative elements would introduce the stigmas that we find in South Asia as well as linguistic barriers. English, Swahili, Arabic, and a couple others act as linguas franca, but they are often supplanted by ethnic languages, especially in rural areas. So we saw an opportunity to create bridges with the people already in the region, providing breast health
or women's health initiatives already. These are nonprofit organizations, non-governmental organizations, or even governmental organizations tied into the increasing efficacy of socialized medicine, as I mentioned earlier. These providers are pivotal to regional success, and we don't think that Pink Detect's mission will succeed without that. Pink Detect has demonstrated the ability to conquer these barriers already through their campaigns in South Asia, through their culturally sensitive app and the workshops.
So what do we actually build? Pink Detect has a proven tool. It reached more than 50,000 women in Pakistan. The technology works. The problem is that in rural East Africa, the women who need it most can't access it through an app. Low smartphone ownership, limited connectivity, little digital literacy. We looked at this and realized that in this environment, the traditional media rollout fails before it starts. We view the problem a little bit differently. The real question was never just about reach. It is about trust. And trust already exists, just not with Pink Detect yet. The answer is in community healthcare workers deployed by NGOs that have been operating in these communities since before Pink Detect existed. Organizations like AMREF, Living Goods, and Village Reach go directly into rural communities that don't have access to the internet. They have the infrastructure, the relationships, and the credibility that Pink Detect cannot build by itself, let alone overnight in one media strategy. Artifact C is a professional NGO partnership brief built in Adobe Express. It is the document Pink Detect would hand to an NGO program director to begin this conversation. It addresses the partner, not the patient. It explains the problem with data, presents a hybrid community healthcare worker program, and closes with a 90-day pilot ask that is specific, realistic, and low risk for the NGO partner. The insight driving this is simple. Putting Pink Detect in the hands of a trusted local NGO does not just solve the distribution problem, it solves the credibility problem. Pink Detect stops being an outside technology company and becomes the platform behind a healthcare worker the community already knows, believes in, and trusts.
Okay, so how do we use Adobe tools? We used Adobe Express to create this document. The key feature that we utilized was data visualization. Adobe Express has integrated graph and table functions and text tools that are very intuitive to use, and we helped design this. I have but one complaint: you cannot decimalize the data visualization.
So our team integrate tools from the Idea Hall workshop. So we use the scripture designer framework inspired by Matthew, a workshop, and to shape how we approach Pink Detect's partnership with the NGO. So we structured as a dialogue between two parties, Pink Detect and the NGO, and each bringing something to other needs. So the Pink Detect bring expertise in community health, engagement, and technology, while the NGO bring in local knowledge, networks, and resources. So by forming this way, we highlight mutual benefits and share goal, making the partnership more engaging and effective, which is this collaborative approach allow Pink Detect and NGO to co-create solutions that leverage each other's strengths, ultimately driving greater impact for human health in East Africa.
All right, so how does the next slide, please? Thank you, Father Brian. How does this actually happen? Phase one is the outreach. Pink Detect would take this brief and put it in front of, for example, it doesn't have to be just this. We trust your discretion. Maybe 5 organizations already operating in the community healthcare worker space. AMREF Health Africa trains over 27,000 community health workers across the continent. Living Goods reaches 8 million people through community healthcare networks that already exist. The infrastructure is there. The goal of phase one is simply to get 2 of these organizations to say yes to a pilot project. Phase 2 is the 90-day pilot project. Partner community healthcare workers are trained on Pink Detect's breast health model. They run screenings during visits. They are already making women who are flagged enter the NGO's existing referral pathway. No new infrastructure is required, no additional travel burden on the patient. Phase 3 is evaluation. Both parties review the data together, how many women were reached, how many were referred, what the community healthcare workers need that wasn't there. The data then informs Pink Detect's next phase. The reason this is achievable is because we are not asking anyone to build something new. We're asking Pink Detect to hand one document to the right person in the right room. That document exists. We built it. We love this solution because it addresses a desperate demographic.
Time is concluded.
Oh, I had a really good one-liner I wanted. Can I say that one?
Yes, go for it.
We believe this solution because it addresses a desperate demographic that we believe hasn't been addressed by anyone yet. That demographic is women who don't have phones of their own.
Thank you. Judges, you have 3 minutes per question and
I
answers.
do not have a question, but good job on, identifying the partners. We've been trying to do that for the last 2 months, and these were the exact partners that we identified. So good job.
Is there a role for the app after? Or do you just have to?
Yeah, the app is in the
Because
hands
they don't
of
have
the community
phones.
healthcare workers. So community healthcare workers are already in rural communities. They already have existing patients or clients, what have you. So
They're using it.
yeah, exactly. So we just need to inform the organizations that are already in these communities what Pink Detect is. And we believe that our document does just that.
Can you make it bigger, the document, please?
Yeah, can we go back?
Yeah, back to slide 2. There we are. It's mostly text.
Which is intentional. This isn't meant to catch someone's attention. This isn't something that, like a media campaign, it needs to be flashing in the Pink Detect colors. This is a real document that real NGOs will look at and take time to consider. You're not just scrolling past it on Instagram. This is something that community healthcare organizers will work with. Yeah.
So if I'm an NGO, do I have to pay for the service or Pink Detect just brings me these resources?
We don't know what Pink Detect's resources are. We feel like it would be unfair to just assume that Pink Detect would do all the training.
I can answer that. Essentially, nonprofits also have an incentive to partner with us because we can apply for grants together as like 2 organizations are coming together, identifying a demographic that is desperate and vulnerable, and basically applying for grants and going together. So it's not going to be a burden on any of the nonprofits, not on Pink Detect, not on the partner organization. And we're basically going to double down on our strengths and apply for grant funding together.
And our document makes the case. This is like the introduction of a partnership agreement is how this document is framed.
That actually answered my question. I was wondering what was in it for them.
Yeah.
Yeah.
So just a quick question. This is the introduction only, like there is follow-up, I guess.
Every organization is different. Every community is different. We believe like no one media strategy or campaign can account for all of East Africa. Neither can one series of documents.
Yeah.
But the one thing that is constant is how you reach out to these NGOs and the jump off point. That's the same for everybody. What comes next is, oh, please.
So how did you identify those 2 groups?
Those 2 groups.
Living Goods and Amra?
Judges, your time has
They're the-
concluded. Team 7, please step forward. Thank you, Team 6.
They're the biggest ones with the most funding that are in the most communities. In the short answer.
Team 7 Tita Akuya and Sakina Jacquet. Team 7, please let me know when you're ready. Ready? Team 7, your time begins now.
Good afternoon, everyone. We're here to share our pitch on Pink Detect's East African expansion. And this is presented by Haram Verk,
Kritika Hujab, Sakina Jacquet.
In East Africa, breast health discussions are often limited by cultural stigmas
fear, and lack of access to reliable information. Many women feel uncomfortable talking about changes in their bodies, which lead to delayed in detection and higher mortality rates. There are also structural challenges such as language diversity and limited access to healthcare professionals, especially in rural areas. While Pink Detect already provides screening and updates, there is a gap in culturally relevant and interactive communication. This creates an opportunity for a solution that builds and delivers information in a way that feels familiar and accessible, specifically through audio storytelling inspired by the region radio culture.
So we want Pink Detect to develop a new frequency. Here is our pitch. Pink Radio. Next slide, please. So we first thought about, okay, we want to incorporate audio. We thought about podcast features, and then we saw Pink Speaks on the app. They're short segments, but we were thinking maybe something longer. And then we took a look at East Africa's engagement, especially when it comes to internet connectivity. And we noticed the radio culture is very, very prominent in East Africa. So we wanted to utilize that. Our radio segments would feature survivor stories, health worker and doctor Q&As, call-ins, and faith-based or community leader segments. I already kind of explained how it works, but this is essentially effective because unlike traditional health messaging, this creates a two-way interactive platform for us to communicate with them.
And then for our use of Adobe tools, we created mock podcast episodes, social media promotional visuals, and educational audio snippets. We wanted to create and refine the podcast style into radio segments and then create engaging and accessible health content in order to create a realistic prototype and campaign materials and demonstrate how Pink Detect can launch and promote the feature. And then for our Idea Hall workshop integration, we use Pink Detect's workshop to create audience-centered, culturally relevant health messaging using storytelling. And then for scriptural reasoning, we wanted to make faith-based messaging in the radio recording to reduce stigma around women's health. And for analytical approaches, we wanted to connect our solution to real impact from awareness to screening.
Okay, so implementation and impact. So our implementation plan have 3 phases. Phase 1, pilot launch. Test Pink Detect Radio with small users group in Kenya. And then second, community integration. Partner with health workers in clinic and promote through radio and social media. Phase 3, regional scaling. Expand to Tanzania and Uganda with localized language and adaptation. And for impact, you're about to witness that.
So let's have our actors come to the stage. Let's set the scene. In rural Kenya, where radio remains the most trusted and accessible medium, our story begins with a newlywed. She lives in a village outside Kisumu, where internet connectivity is sparse and smartphones are rare. Every morning, she sees her husband off to work and begins her daily chores accompanied by the familiar hum of Kiss 100 FM. Next slide. Playing from her small radio. But today, as she sweeps the floor, a sharp pain shoots through her chest, a pain she's quietly endured for weeks. She's also noticed a change in her breast, swelling and dimpling that she's too ashamed to speak about, a fear of the judgment that keeps her silent. As she flips through radio stations, a voice cuts through. Ladies, if you felt pain, swelling, or changes within yourself, don't wait. Here is Pink Radio. The station name catches her ear. Pink Radio? It sounds familiar, as her cousin in the city listened to the podcast version. But this is different. It's on her radio. It's in her language, and it's speaking directly to her. She pauses, then listens. Next slide.
There's supposed to be a video. It doesn't seem to be working.
And I will make that work now.
Oh, wait, there it is. Now it is working.
He's not at the bottom.
The backup.
No, that wouldn't work.
I can play it right here.
Why don't you play it right there?
Ladies, if you felt pain, swelling, or changes within yourself, don't wait. Here is Pink Radio.
Good morning, ladies. You're tuned into Pink Detect Radio, broadcasting in your local language to reach every woman and every home. Before we begin, let's take a moment to settle in. We'll spend just 10 minutes together talking about something that matters deeply, your health. Take a moment to situate yourself or tune back in whenever comfortable. Today, we're joined by Nurse Atino from Kisumu County Hospital. She'll answer questions we've received from women across the region and questions about women's health when it comes to chest pain, swelling, and what early screening really means.
Hello, all. I am more than happy to join you guys here today to speak about issues that touch every woman. We understand that women feel afraid or ashamed to speak about their bodies. However, as sisters, it is our duty to care for one another because silence can be dangerous.
Oh, do you hear that? It looks like we have someone calling in with a story or a question. Let's get them through.
Hello. I would like to stay anonymous, but I wanted to share my story to straighten the women around me. I currently live in Kisumu with my big family. I always felt a lump in my chest, but kept quiet. I didn't know what it meant.
Oh my, that's so unfortunate.
Then I heard this radio show. I joined the WhatsApp group.
Thank you. You have 3 minutes for question and answer starting now.
Hey. I think it's a really cool idea. I just had a question about, so, you're talking about, people who might feel something in their breast, they might feel a symptom and then are looking for something in the radio for that. But what about people who just need to know this information because it can help them? How would you, I guess, get people to actually listen to a radio that's specific to a particular topic without them actually having to, maybe they're not dealing with that problem yet. Do you know what I mean?
I can take that. Especially like we had mentioned before in the radio, there will be different segments so that we can consistently switch it up. You know what I mean? So for instance, if we're having a community leader on that segment, we would want that's someone that's important to that community and someone that, people would tune in to listen. And at the end of the day, breast health in itself is something that affects like many women. I don't want to give like a specific statistic, for the sake of credibility, but it's like no, as a man, if you're tuning into that radio, you would never know if your mother, your sister, or your wife might be dealing with that. And we want to not only educate women that might be suffering with, breast cancer and wouldn't know, but also people with family members, women around them, and even men themselves can be diagnosed with breast cancer. So I think that it's something important. And aside from that, we would also have like medical professionals on there where people could listen in. And it's not specifically just about breast health, it's also like mental health wellness, checking in on your family. How do they feel? Stuff like that.
Okay, thank you. Cool.
Some details that maybe you could inform us about. How would you start up this radio station? Like, where would you get the funding? Are there going to be community partnerships? Like, what's your plan for the media aspect of this?
I think at least for the funding and media aspect, they could also just be donors and NGOs that want to work with us to create a media, as well as maybe local stations that we can talk to in the area that are already well known and try to get a channel on there. At least that's where I see that coming in from. And for funding, I think that would depend obviously on Pink Detect and what they have, and then having to organize with other maybe breast cancer awareness in the area as well. I think we had researched one that is
The Breast Cancer Institute of East Africa.
yes, and maybe collab with them to create a radio there.
And just to kind of add on to that, there have been, so we also wanted to make sure that we're culturally sensitive in that sense. So we were looking into Kenya and if they have already aired segments on breast cancer. And there have been. However, they're only very periodical. They're not consistent where, okay, it's Breast Cancer Awareness Day. The day is full
Judges, your time is such broadcast. Thank you. Thank you, Team 7.
So Team 8 did not have the opportunity to send a slide deck to me in time for me to incorporate it into the master presentation. So I'm going to give them the opportunity if they would like to present without visual aids. Something is better than nothing.
Members of Team A are Addison Cook Gibbs, Bernard Miller, and Mallory Felker.
Addison is stuck in an airport right now, so it's just me, Mallory, and Bernard.
Hello, everybody.
Okay, your time begins now.
Hi, so the proposal that we would like to make is to use photojournalism and video journalism to portray individual stories of people in East Africa to hopefully help gain funds to better the medical situation happening there, as well as better inform the public in the area to destigmatize breast health. Specifically, we found that, as mentioned earlier, we're lacking in early detections in this area of the world, and specifically found in an article released by the National Library of Medicine. While in the US, women diagnosed with breast cancer only have a 2.3 to 2.6% chance of dying. People living in East Africa have a 54 to 55% chance of dying because they're not being diagnosed early enough. Of course, that is why this matters. And so with our campaign, the target audience that we hope to reach is funders, of course, to help build the institutes that already exist in this area, starting first with the people who may come across our social media campaigns, individual funders willing to donate to the cause, and then hopefully raising up to maybe larger companies willing to partner with us. And then second, we want our target audience to be members living within the community and hoping to destigmatize the breast cancer and urging them to go to medical facilities early on.
So with that being said, our proposal would be a digital storytelling and fundraising campaign. We would want to share stories, photos, and quotes from East African survivors.
Specifically.
Yes, we want to include real testimonies from real women like Liana Miltandi, and have a news outlet essentially highlight these stories. We also want to distribute social media ads and possible partnerships with other brand or organizations that have vested interest in breast cancer awareness. We're hoping that this will be effective and reach out to global audiences, such as like donors, students, online youth. That way we could bring attention, especially NGOs. And we also want to establish like a emotional connection. That way we can increase awareness that way and increase donation using said outreach.
How we used Adobe Express to enhance our project. Of course, we used it to create what we have here, but we also think that it could be very influential in the future process of this project. Specifically, if we're able to get in contact with women living in the area and hear their individual stories that we hope to share, we can use programs like Photoshop to help create their images, as well as Adobe Premiere to help create more cinematic imagery for social media campaigns, and then maybe eventually more traditional commercials to air either on TV or YouTube or something. And then how the idea halls have helped us to come up with this idea. Specifically, the first one, the Pink Detect social media content creation, we used to help shape our idea of what could be used to post on social media. Also helped us to understand the cultural issues that this region may face and how that may need to be addressed. With the scriptural reasoning idea hall, that helped us to better understand the importance of open communication, like between cultures, and how sometimes having those conversations, however hard it may be, helps you to maybe see things in a different light, which we hope to help bring into that community and help them to see things in a different light. And then for the analytical approaches, specifically towards the end of that workshop, we did a project planning kind of activity, and we used that to help us understand how to plan this project specifically.
In terms of implementation, We think Pink Detect can partner with local photographers and videographers to, again, give a spotlight to survivors and healthcare organizations. We think an online gallery and videos alongside in-person exhibits and at campuses and hospitals would be extremely effective. We kind of set a timeline out for this as well. So a 4-phase timeline. Phase 1 will be planning and outreach. That would include essentially getting everybody together, finding representatives. Plan 2 or phase 2 would be content creation, the actual photo shoots, the interviews, which could be anonymous or anonymous, depending. Phase 3 would be a full-on campaign launch, which would be the exhibitions, the exhibits, as well as social media. And then phase 4, we would want like promotions, partnerships to be involved, and overall feedback in terms of making it better and then spreading it to other regions.
Judges, you have 3 minutes for question and answer starting now.
So there's been a lot of talk about stigma. I'm not sure if you talked about it or if the other groups did, but how would you overcome that in terms of having people share their stories?
I think anytime somebody is sharing their own individual story, it kind of like pulls on people's heartstrings. So I think specifically in the area, if people hear from their own community members who have suffered from breast cancer or late diagnoses, it can maybe help them to understand why it is so important for these things to be diagnosed early. And especially like if it is their community members, they can be like, oh, like I didn't know that about you.
But the question was, if I'm going to tell my story, how are you going to convince me to do that? Do you see what I'm saying? The person who.
Yeah, sorry. I thought you meant like
Yeah.
within the community. I think it's like with an open arm, I guess. I don't know. Just try to be as like loving and caring and
We could also just highlight other essential survivors, like the woman that we had mentioned before, the success that she had gotten from coming out and the outreach that she provided. Again, it doesn't have to be, you don't have to put your face out there. It can be an anonymous thing. But just in terms of being able to reach out to other women, highlighting women definitely helps.
Sorry, questions from projects.
What happens if there's an area that doesn't have like a local videographer or photographer or people with that kind of equipment in it? Then how would you get stories from people in that community out to other members of that community?
I think hopefully if there's not one in a specific area with our original campaign, if we've been able to collect enough, maybe we could raise enough funding to send, like have people travel to the area.
Okay.
Who may be skilled enough to handle the matters.
Thank you. Asosa Ochieng, Daniela Colazos Vargas, and Sabine. Nine, your time begins now.
All right, hello everyone. I'm Asoso Chang.
I'm Daniela.
I'm Savannah, and this is Project Story. This is a brief table of content. Okay, so to first analyze kind of the issue that we're looking to solve is really establishing a secure foothold for breast cancer awareness and initiatives in East Africa through Pink Detect and really spreading that mission, as well as implementing existing resources to the region. As you'll see, our artifact is going to center around photos and sharing media and photojournalism. So this specifically matters because photos and media really tell their own story that can speak much louder than words and can really share a different picture. And then engaging communication methods, connecting further developed initiative to the region from anywhere in the world. So as you'll see through our artifact, being able to engage with what already exists from anywhere in the world to the through digital methods is really important to
again, establish this foothold in the region. So the target audience is really honestly anyone related to this. So patients, survivors, family, friends, supporters, and specifically breast cancer awareness campaigns or initiatives that can be started. And then the opportunities created are a dissemination of knowledge, programming, information, and anything else at a more rapid rate, and connections for individuals around the world to share vast arrays of information and media in a more effective manner.
So not just only that, we're also going to focus on we are still talking about social media and we still want to implement that, but as well, knowing as some groups have said in the past before we presented, social media and internet access is very limited, especially in East Africa. So we want to ensure trust, especially because Pink Detect is basically all surrounded by trust. We want everyone to be able to share their stories and confide in us. So we aim to collaborate with local health centers, community leaders, and women's groups to spread information. And we also want to implement hands-on workshops in both rural and urban areas. We also did implement having, which you'll see later, visual aids, which you talked about earlier with our photojournalism posters, as well as pamphlets, and also combining our resources with the local radios within, for example, Tanzania and Kenya. So this also goes back into a little more detailed description of who our main audience is. So for this section of our proposal, we want to target women living to remote or underserved areas, where access to healthcare and the internet is limited. The workshop includes local healthcare providers and hopefully Pin Detect volunteers. Again, I can't speak for what they can provide, but who spread information as well as encourage leaders, as well as community leaders who encourage open conversations about breast health. So to address any concerns to this campaign, we wanted to focus mainly on culturally sensitive education, and we want to use simple, low-tech communication methods combined with face-to-face interaction, which does allow information to be more accessible and efficient across different communities. So we did use Adobe Express, and the way we used it was, you can go to the next slide. We use Adobe Express to design our campaign materials through photojournalism. We tell a story using images that communicate important health messages instantly. This is especially important in areas where language barriers or varying literacy levels, because the visual makes the message clear at a glance. We also created mini flyers. Thank you. I'm also showing Adobe's translation tool in the app. So, which we thought was really cool. We wanted to implement that. But creating these easily printed and translated into different languages flyers, Adobe allows us to keep a consistent design adapted to adapt content quickly and share materials both digitally and physically. Overall, this makes our campaign a little more flexible and easy to expand.
And now in relation to the Idea Hall workshops, from the social media content creation workshop, I wanted to highlight the connection that we learned about. It is very important to start with that basis of connection when introducing Pick Detect to the communities, because using these photos, you can share stories that emulate a sort of kinship with the viewers. And moving on to the scriptural reasoning workshop, I wanted to highlight that point of discussion. Shared stories lead to discussing the shared stories and understanding one another even further. And the final workshop, analytical approaches, highlighted how you approach these cases. You want to take into consideration differing factors that may affect how you come to the solution.
So looking at implementation, we, as you saw, like for our artifact, we focused on photojournalism and collecting photos to really tell a story. And so what this looks like for implementation is integrating it into the Pink Detect app and creating an interactive media sharing space within that app. So creating communities based around, like, maybe it's programming of how to put on events or different, like maybe somewhere in one country, they put on an event for breast cancer awareness, and they're able to share photos, videos, anything from that event, and share it to an event-specific community, so that can be replicated in another area, or where people can anonymously share their stories, and what they've been through. And then the outcomes are community engagement globally, creating connections so individuals again can connect with people across the globe and see what is possible and spreading awareness again to the region. And then, as I said, connecting individuals through shared experience. So timeline for this would be developing guidelines for sharing content and interaction, and then implementing these features into the Pink Detect app, and then measuring success by tracking monthly engagement, measuring key engagement statistics, how many posts are created, what is being shared, how many members are engaged. Yeah.
Judges, you have 3 minutes for a question and answer starting now.
This seems to be very reliant on technology, like uploading photos into an app would take a lot of bandwidth in order to be able to do that. So how would you address uploading those potentially high resolution images into this app in an area where the technology might struggle to do that?
Well, I think it doesn't even necessarily need to be like high resolution. I think it's really being authentic and sharing your personal experience and sharing like real experiences. So in some areas that might look like we could hire like something, but really again like what is possible there and again real. So maybe areas in the there's areas like surrounding areas that may have better like access to technology, and then from there again like connecting digitally, so from one area that maybe like have higher bandwidth I think you used to somewhere that is closer to those lower bandwidth areas, and really like just spreading the information there, because again it's a place to share ideas, so sharing that to those surrounding areas can then I'm like losing my train of thought, can then spread that to the lower bandwidth areas.
So can you put the previous slide, or Brian, could you put the previous slide up there? So in the measures of success, one of the things I had come up almost from an opposite perspective as the previous question was, there was a lot in the work that you're doing which is face-to-face or which is interactive. But in the measures of success, I don't quite see that. It seems to be relying on more on digital technology and that kind of thing. So how would you suggest that that the success or the distribution of what you're doing be shared interactively and not digitally?
Well, I think again, kind of the idea of sharing it globally starts digitally with sharing ideas from across the globe, and then seeing those events. So maybe that looks like engaging in those events, having people go there, go to these events, see what's being put on, then track like actual in-person engagement with events, how many people are going to those, the success, the outcomes, what workshops are being actually physically created and put on as a result of sharing.
Can I ask a quick question of Pink Detect first and then of the speakers? Do you all have a measure of impact of reduced mortality or rates of breast cancer? Do your impact goals go that far?
Yeah.
Okay. Well, I was going to ask you guys to make that work. Okay.
Thank you. Team 9. Students, thank you for your presentations. They were amazing. And judges, thank you for your attention and questions. At this time, we will take a 10-minute break while the judges deliberate and select our hackathon winners. Please help yourself to the refreshments in the back and take your time to mingle and network with your colleagues. Dear guests, we will now begin the second part of tonight's event, which is the official launch ceremony of UPIC. Please take this time to return to your seats. I'd like to introduce my fellow UPIC student representative, Caitlin Wilson, to the podium to begin UPIC's official launch party. Please give Caitlin a round of applause.
Thank you all for coming to tonight's official launch of UPIC as a practical peace building program under the U.S. Center for Peace, which includes the launch of our new website. My name is Caitlin Wilson, and I, along with Safwan Ali and Joel Aswak, form UPIC's inaugural cohort of graduate student representatives. Over the past academic year, we've been working together on establishing UPIC at Seton Hall. One important project was organizing UPIC's digital archive in order to revitalize its online presence in preparation for a new chapter at UPIC, which we call UPIC 2.0. The transition to UPIC 2.0 came with many challenges, chief among them being how to engage with a post-pandemic audience in an increasingly hybrid world. After a few rough drafts of the website design, and with the help of Linda Carton at Seton Hall University Relations and the TLTC team, we were able to put together a website that connects UPIC to its new home at Seton Hall while still maintaining the organization's history and central focus. The thought process going into the creation of the new UPIC website was to translate the founding message of the organization into a straightforward design that would catch a reader's eye and maintain their attention without overloading them with information. This focus on visual presentation led to the creation of our UPIC intro video, which we will present to you shortly. We wanted the video to show some of the real people behind UPIC's work, as well as highlight some of the Ideal Hall workshops that have taken place this semester. UPIC has an archive full of work from its pre-pandemic phase that will live in the website eventually. The site is still in the process of being updated and will continue to add more as UPIC's presence at Seton Hall continues to grow. The UPIC website will become a home to all the hackathon solutions presented by today's student teams. It will also feature new organizational documents like the UPIC Charter, which was created by fellow UPIC rep Joella Zwack. And Joella is handing out mini versions of the UPIC Charter right now. Even though the site is currently small, it represents a new stage in UPIC's legacy as a peace-building and experiential learning program under Seton Hall School of Diplomacy. The site is a culmination of the work of us UPIC student reps over the past academic year, and I'm very proud to present it to you. Without further ado, here is the website. Here it is in all glory. And now we will present to you the intro video, which just gives a little bit of a taste of the UPIC's mission and the work here at Seton Hall.
The U.S.-Pakistan Intercultural Coalition, or UPIC, acts as a cross-cultural, interdisciplinary initiative anchored at Seton Hall University's Center for United Nations and Global Governance Studies.
For me, UPIC is all about connectivity, harmony, and breaking the stereotypes.
UPIC unites key civil society members, such as religious leaders, community change makers, scholars, and students from the United States and Pakistan towards a common peace-building mission.
When I think of UPIC, I think about bridging cultural gaps and bringing together Pakistanis and Americans wherever they might be.
UPIC represents an innovative way to do partnerships between Americans and Pakistanis to work towards peace, justice, and human dignity.
UPIC recognizes the need for constructive engagement between these two countries and uses principles of empathy, collaboration, education, dialogue, and mutual respect to build sustainable partnerships.
When I think of UPIC, I think of diplomacy and peace building.
When I think of UPIC, I think of openness and safety with the person at the center of care.
True diplomacy extends beyond traditional institutions and states and begins with people who are willing to listen, to learn, and act together.
See, a lot of you guys are actually featured from the Ideal Hall workshops. Father Brian, if you don't mind scrolling back to the last slide. So the site homepage showcases a group photo of students from Father Brian's United Nations Field Seminar course from March of 2025, along with UPIC leaders and Suhail Alani from Pink Detect, after a UPIC guest lecture. This guest lecture was Saffron Ali's first introduction to UPIC, after which he decided to join as a UPIC student representative. And some of the students today also presented in today's hackathon. Thank you for supporting our work. I hope you all had as much fun watching the video as we did creating it. Please do visit the UPIC website as we continue adding content and building UPIC under Seton Hall. I would like to now invite Father Brian Musas to the podium to present a special student showcase of Instagram posts created in collaboration with Pink Detect for this course.
I just wanted to say something about Digital Artifact A. Um, Digital Artifact A, the first part of a series of digital artifact assignments, is a collaboration between Seton Hall University and Pink Detect. Students are acting as diplomacy and international relations marketing team members to help support Pink Detect's social media outreach. And so as part of their skill building training and kickstarting a social media collaboration between Seton Hall and Pink Detect, each student created a single piece of content, either a post or a short video, to communicate part of Pink Detect's global health mission. The students' work will be featured on Pink Detect's official Instagram account as part of their ongoing work. In this way, the project connects academic learning with real-world health advocacy and global public communication. If I may say so, this semester's Artifact A assignments are head and shoulders above any previous Artifact A assignments, whether for the Religion, Race, and International Relations course or any other courses I have taught and used that assignment. Congratulations. Please enjoy this showcase of our student talent. And now I would like to invite UPIC's co-founder, Reverend Bob Chase, to approach the podium and share a few remarks. Bob, the floor is yours.
Father Brian, thank you all for coming. Oh, my name is Bob Chase, and as Brian said, I'm the co-founder of UPIC. So I want to just share some thoughts about the past and then some ideas about the future. Back in 2011, against the context of the global war on terror, UPIC was born in an innovative way to improve the relationship between the US and Pakistan. Since then, UPIC has brought together religious leaders from 3 Abrahamic faiths, community organizers, scholars, and students from both countries, and met annually, usually in Pakistan, to engage in dialogue around the pressing issues of the day with 3 goals in mind. 1, to build interpersonal relationships as distinct from governmental or organizational relationships. 2, to shatter stereotypes among both Americans and Pakistanis. And 3, to develop an action agenda together that works towards peace with justice, economic development, human rights, financial inequality, women's empowerment, education, and interreligious harmony. At the height of the global war on terror, the relationship between our 2 countries was fragile at best and often volatile and deeply suspicious. So I'd like to just tell you a little story. It's a true story about what happened way back then. My first trip to Pakistan, I was at the International Islamic University in Islamabad, and I walked into a hall right off the plane, basically, and there was about 200 people in the room, a big hall. And on the board, it said, "Contemporary Trends in American Christianity" by Reverend Robert Chase. Nobody told me I was going to have to make a presentation to that group, and so I panicked. So what did we do? Okay, so I said, okay, let's do something interactive, right? So I said, how many of you have ever been to America? Well, nobody raised their hand. I said, how many of you know Americans? And well, maybe 2 or 3, mostly faculty, I think, raised their hand. And then I said, so what do you think of America? Well, just, or Americans. I said, just talk among yourselves and we'll see what the answer is. So the first person that I called on thereafter, I said, so what's your answer to that question? What do you think of Americans? And he was about halfway down the hall and he stepped in the aisle and he said, "You're all terrorists." So that was, well, welcome to Pakistan. So about 6 months later, I was at Central College in Iowa. Okay, Central College in Iowa, and I was doing a presentation on the relationship between the US and Pakistan. And I said, so how many of you have ever been to Pakistan? Of course, nobody put their hand up because it's very difficult for Americans to go to Pakistan. It's not difficult to go to the UK. It's not difficult to go to Japan. It's very difficult to go to Pakistan. So nobody put their hand up. I said, so how many of you know any Pakistanis? And, 1 or 2 put their hands up. And then I said, so what do you think of Pakistanis? I said, talk among yourselves and come up with an answer. So 2 minutes later, 3 minutes later, whatever it was, somebody stood up and called on him, to him again. And I said, so what's your answer? And he said, they're all terrorists. The exact same answer in each setting. So that was the context in which UPIC was born. It was a serious context. Now, over the years, the relationship between the US and Pakistan has slipped in and out of the headlines. Just this week, as you know, maybe just even today, Pakistani officials are seeking to broker an end to the conflict with Iran. But as the second largest Muslim majority country and a nuclear armed nation, it's essential that irrespective of the headlines, we maintain a relationship between our two countries that seeks to promote peace and human dignity in a violent and often conflicted world. Post-COVID, we've been laying the groundwork for a launch of UPIC 2.0, an official program here at Seton Hall University under the leadership of Anjem Malik, a Pakistani Canadian who has wide experience in community organizing, especially in rural Pakistan. She'd be too modest to tell you that, but her organizing work is incredible. She's both detail-oriented and has an expansive vision of what's possible for UPIC. And under her direction, our current emphasis is on engaging students, faculty, and staff here at Seton Hall and beyond in skill building within the context of international relations, using the principles of sustained presence, active listening, trust building that UPIC has employed for a decade and a half. And collaborating with secular partners beyond Seton Hall, Pink Detect, Just Results, LLC, and the Rose Castle Foundation, UPIC has a unique opportunity to bring together ethical principles and faith-informed values to build a better world, an important convergence for this university community and the well-being of the whole world. UPIC family is grateful for Seton Hall's wisdom, counsel, and support. And I thank you all for being here tonight.
Thank you, Reverend Bob, for those inspiring words. Thank you for planting the seeds of UPIC. And thank you for entrusting us and our students here at Seton Hall with taking UPIC to the 2.0 level. We are now at the final stage of tonight's program. The judges have finished their deliberation and selected the winning teams. It is my pleasure to kickstart the Idea Hall closing ceremony and prize distribution. I would like to invite Reverend Bob Chase and Sue Halalani as our special guests to please come forward and present the certificates and appreciation gifts. We would first like to honor the organizers, volunteers, and partners whose support was so crucial to the success of the Idea Hall project. When I call your names, please come forward to receive your gift bag and allow us to take a commemorative group photo with you. We have a TLTC student, Cooper, who will be doing the photographing honors. Thanks, Cooper, for helping us out. First up, I would like to call on stage diplomacy graduate student and UPIC student representative, Caitlin Wilson.
Somebody for the picture? Yes. And this is the back. Okay.
All right, everyone's gonna center yourself next to, in front of that picture, please. So everybody scooch a little bit that way. A little bit more. There we go.
All of us?
Yes, yes.
All right, you guys step forward and I'll get behind you. For some reason, that seems to work better.
3, 2, 1. Don't blink, don't blink. Hold on, I'm gonna do one more. Got you guys.
Okay, thank you.
Next, I would please like to call Safwan Ali.
Second. Got you.
And lastly, our final UPIC student representative and diplomacy grad student, Joella Zwack.
Got you guys.
Thank you. Could I please ask all of the UPIC student reps to come on stage for a group photograph as well?
Got you guys.
Thank you. Okay. Next, where would we be without our fearless course instructor, UN Center Director, and perpetual UPIC champion, Father Brian Muthas?
Got you guys.
Thank you.
Father Brian, stay. We're gonna have another quick group photograph with all our UPIC student reps.
I can do that.
Safwan and Joella, could you quickly come back? One last photograph.
All right, everybody's got to squeeze in a little bit more. All right, you guys are gonna hate me a little bit more. Hold on. Maybe try and layer a little bit, like trying to, yep. Yeah, a little bit more.
Maybe.
Perfect, you guys are good. Thank you. Got you guys.
Thank you. Thank you so much. Next, the digital creator of the Idea Hall workshop flyers and events promotion extraordinaire, Zuleha Chite, please.
You can stand here, they want your picture.
Okay, sure.
Your image belongs to me.
Got you guys.
And now for our judges who organized incredible skill building workshops for our students and then committed a second time to serving as hackathon judges. I'd first like to invite Kate Sierra from TLTC.
Good. Thank you.
Secondly, Solmaz Ibrahimi Iranpur from Pink Detect. Thank you. And finally, Lara Goldmark from Just Results. Could we please have all of the judges come on stage for it? Thank you. Thank you, organizers, volunteers, partners, and judges. We now move on to the prize distribution for the student winners. Before announcing the hackathon winning team, we have two special prizes for Best Artifact A and Artifact B digital assignments. Because you guys did such a great job and you wowed Father Brian, you wowed me, you wowed Solmaz, we figured it was very important to give out Best Artifact A and Artifact B prizes. So, without further ado,
The winner of the Best Artifact A or Instagram Post Award goes to, there will be a certificate and a gift bag this time. I so Sao Chiang.
Thank you guys.
Thank you, I so Sao. Next, the winner of Best Artifact B goes to Raymond Clairvaux.
Congratulations.
And now the moment you've all been waiting for. Hackathon winning teams. We're going to start from third place, then second, and finally first place. In third place, and before I give out the names, the judges have asked me to say that they were incredibly impressed with all the student teams, and they had a very difficult time figuring out who to pick. In fact, they told me that they had to revisit and deliberate a number of times before they selected the winner. So a round of applause to all of you for your. Third place, we have Team 4, Lamont Howard, Aya Gozamal Seed, and Kennedy Myers. Please come up.
I'm down.
Yeah.
Do we have time? Oh,
Give me a couple seconds here. All right, everybody look at me. Don't blink, don't blink. Got you guys.
In second place, we have Team 3, Luke Bays, Raymond Clairvaux, and Yanni Dedis. Please come on.
Yeah, that's me.
I feel like the mascot right now.
Don't blink, don't blink. Got you guys.
And finally, first prize, who gets to do an accelerated externship with Pink Detect over this summer. Team 6, Aminata Dakur, Ryan McCafferty, and Robert Hughes.
Oh, this one happened. Oh, my goodness. Oh, my God. Okay, this is yours. We all took it.
It's teamwork.
The bags are with me.
On the other side? Oh, okay.
So you're with your group, you're with your group. Ready, 3, 2, 1, don't blink, don't blink. Got you guys.
That concludes the prize distribution ceremony. I hope you enjoy the souvenirs that we got from Pakistan for you guys.
I know, excited.
And thank you again, students, for your hard work and creativity. We have reached the final part. Hold up, you guys, hold up. It's not over till I say it is.
That's why she's the executive director.
Just one more thing before you guys are done for the night. We have a final part of tonight's program. It's my pleasure to invite Father Brian Muthas to the podium to give the closing remarks of the Idea Hall project. Father Brian, podium is yours. Thank you.
Don't worry, I will set you free very shortly. But first, I want to share a few thoughts. Number one, gratitude to our partners. They include 3 external collaborators, Just Results, the Rose Castle Foundation, and Pink Detect, for bringing real-world challenges that allowed our students to connect academic insight with global impact. They also include 4 cross-campus partners, the Teaching, Learning, and Technology Center, the University Core Campus Ministry, and DOVE, the Division of Volunteer Efforts, who have shown what is possible when academic and non-academic university programs work together to connect ideas, skills, and mission. Number 2, the importance of students putting ideas into action in service of the common good. The projects presented today remind us that innovation is not only about technology or creativity. It is about using our talents to address real human needs. Today's participants showed that students can contribute meaningfully to conversations about diplomacy, social justice, peace building, and global health. A hackathon is not the end of a conversation, but the beginning. The ideas generated here today have the potential to continue developing in classrooms, partnerships, and future initiatives. Third, the spirit of Idea Hall. What we witnessed today reflects the heart of Idea Hall, bringing together scholarship, service, and collaboration to imagine solutions that extend far beyond our campus. In recognition thereof, I would like to invite the entire Religion, Race, and International Relations class to come forward for a photo. Nicely done. Come on.
Oh my God. No, I'm getting cold. Oh my God.
Class. They're all fussing over there far away from the professor.
Tell guys, quick.
Go by Raymond.
Oh, no, sorry. I'll stand with Raymond wherever you guys. Not small, but small.
Maybe you could do like crown. I'm in the front, the other one, I don't want you to graduate. How are they gonna get? Oh, okay, so that makes sense.
You reach this.
Wow.
Oh,
Super wide angle lens.
No, I never got to do that, unfortunately.
Everybody look at me, don't blink, don't blink, don't blink. The camera is going off, it just got a silent shutter, I promise. Just, I figured I should say that now, you know, just in case anybody's wondering, I am taking pictures right now, so definitely don't blink. All right, good, got you guys.
Thank you.
It's our evening event. Thank you for your attention.
Thank you. Yeah, I appreciate that. Great job, man. Very nice.
Now, I'm in my keys before I do anything.